We'll try not to hurt ourselves up here, first thing. Good afternoon, everyone. I'm Joel Beiswinger, President and CEO of Tri-County Healthcare, and it's my privilege and honor to welcome you today to the groundbreaking for the new Rural Health Center of the Future here at Tri-County Healthcare and the communities of Wadena and the surrounding area. I want to welcome all of you who are here in person, also those who are watching the live stream event, and all of those who will watch the recorded event at a future time. We're here today to celebrate Tri-County's mission of improving the health of the communities we serve and our vision of being your trusted partner for life. So as I kick this off and I prepared for today, I did quite a bit of reflecting, and I go back to our history. The Wesley Hospital was built as a mission of the Methodist Church in 1925, opened in January of that year. Served the community in a great way for many, many years. In the early 70s, the now community-based board that had taken over the hospital in the 1940s had the vision that a new hospital was needed to serve the next generation and opened what was then the new Tri-County Hospital on the west side of Highway 71. That building also has served us well for many years, but our board, similar to the 70s, had the vision to realize that healthcare is changing significantly and we need to think differently. So we will be opening this new facility in early 2023, 49 years after the original Tri-County Hospital opened. Interesting parallel that both buildings served us well for 49 years. Throughout the years, there were many additions and remodelings to the present facility. The last big thing where we added 30,000 square feet in the south end of the campus and remodeled about half of the facility, and trust me, that was a painful remodeling for everybody that lived through it while we were trying to operate the facility. It happened in 2005, and since then there have been continual projects all the way up through 2017. In fact, the standing joke amongst the staff and around the community was, when will Tri-County stop building? And my answer always was, probably never. But around 2014, we started to take a different look at things and really tried to start planning what was the long-term future of the facility. And for about 3 years, we really just could not come up with the right answer for how we could adapt the current campus to what we saw as the future healthcare needs of our communities. So therefore, we made the decision in 2017 that we would engage in a long-term strategic master plan. We hired HGA architects to facilitate that for us. And about 15 months later, we had concluded that the right answer was to take on the planning for this facility. So mid-2018, we started that work. So you do that math, we've really been at this now for 7 years, thinking about this long-term campus for the facility. So this monumental day is the culmination really of 4 very hard works in great earnest with many, many people. Thousands of hours of work. The recipe for this has been creativity and passion for the people involved. A lot of intelligence and wisdom. A fair amount of stress, some hand-wringing and sleepless nights, but I'd say above and beyond anything else, a lot of courage for people to step out and take some risks to make this happen. And one other part of the recipe was a delay for a global pandemic. Somehow we overcame that. So today, as I reflect on all of our work, I come with many emotions. Joy and elation, first of all, that we've actually been able to bring our vision to fruition. Relief that we were able to get it done and get through all of the roadblocks that we encountered. And great pride in all of the people that did this great work, our partners, our staff, the Tri-County family, board, everybody that had a part in this. And, of course, much thankfulness. So with that, I do want to offer some thanks to many organizations and groups that help participate in this. First, to the marketing team and their support who helped put this event together. Put a round of applause for staging this area to make this work for us today. Thank you, Molly and team. With our legacy being a faith-based organization from our origination, I do want to offer thanks to God for all the blessings He's bestowed on us, the wisdom to get to where we are, and for granting us a nice break in the weather and a beautiful day for this event. First, I'm going to recognize the Tri-County Board of Directors. I used the word courage earlier, and they extended a great deal of courage to make the very hard decision to invest $72 million into this project. Thank you, Board, for your support and your guidance throughout all of this. The Tri-County family, our staff, physicians, providers, and leaders. You put in thousands of hours of work and have ended up with a great project. And the best example I've got of that is when we went through the COVID delay and came out of it in August after about 5 months, we did what we needed to do, which was revisit the entire design. Now that we have learned to understand how to operate within a airborne illness like COVID, we needed to see what we should change in our facility. And we did make some significant changes in our air handling systems that will help protect our patients even more. But beyond that, nothing. And that is testament to the great facility that we designed. So you should all be very proud of the outcome of that work and your input. I want to offer thanks to the Tri-County Foundation and our donors for all of their generosity. You'll hear a little bit more about that from Jolene Johannes, our Foundation Board Chair, later. I want to recognize our planning partners, Orb Management, our owner's representative, HCA Architects and their consulting engineer, Dunham Engineering, Mortensen Construction, and many, many others working behind the scenes to support all of us through this work. Our financing partners, USDA Rural Development, the primary financing agency on the project, and in adding up, I think this is our 11th project since I've been at Tri-County since 1998, so they've been a great partner for us over the years. Old National Bank, along with most of our local and regional banks who participated with them for the supplemental financing. National Healthcare Capital, those folks have been with us over the past 3 years to help get us to this point as they brokered our financing. And the cities of Wadena, Bertha, Verndale, and Deer Creek for offering conduit financing so we could get tax-exempt rates on the project. And our construction partners, Mortensen Construction, but along with them, 25 primary subcontractors who will be doing the project and dozens of Tier 2 subcontractors that will be working with them. And also the City of Wadena, who's taking on the efforts on the infrastructure development, and Wadena County, who will help lead the road reconstruction. So for me to wrap up my segment of the presentation here, I do want to recognize that this project, this facility, will be a giant leap forward for us as a community and for our health. Our theme for the project is inspire, build, and transform. And the inspiration that all of our people have shown to get us to this point, we now can celebrate the excitement of actually getting to build this thing. And we know that it will help transform health status, and health care in our communities for generations to come. So with that, I now want to introduce our next set of speakers. So first up is Terry Davis, who is the Tri-County Healthcare Board Chairman.
Thank you, Joel. Again, I'd like to welcome you also on this beautiful day. Wasn't always looking this way, but it turned out to be great. This is also an extremely important day for the future of quality health care here in the Wadena area. We're really excited about this. The Board of Directors recognizes that the people inside those walls are going to be the most important factor in creating really quality health care, and we've got a great staff. So this is going to really help them even do better than they've done, and they've done a great job already, but this is going to make them more efficient. It's going to allow them to do bigger and better things. It's just going to be very, very helpful for them. As Joel indicated, this is a process we've been going through for a number of years. I didn't look back as far as Joel did to come up with the dates, but I remember talking about it many years ago, and actually in my opinion was that, it seems like a pretty big reach to build a new building. We did know that we had a number of issues at the existing facility that were going to take millions of dollars to fix. And so we determined that we needed to research this further and find out what is the best option for us. We engaged our outside accounting firm to do a bunch of studies for us and researching things like what will happen to us if we do nothing over the next 5 years, if we do some patchwork remodelings, or if we do a major remodel, or if we were to do a brand new building. And then we'd throw other scenarios at them as if what happens if this happens or that happens. And as we were going through the process, it was quite evident that you people probably, you shouldn't want this building. You need this building. I mean, it was shocking to me. I was on one side of it, and I've totally flipped. This is, from my opinion, a really simple decision for us to make in moving forward with this. I know Joel has thanked a lot of people. I second that totally. It's without all these people, this would not have happened. But I do want to single out a couple people. One is Joel himself. He's the leader of us. And without his leading through this process, his positive attitude through it, there's a lot of times when it would have been real easy not to be real positive. But he stayed the course, and we've worked our way through this. So Joel, thank you. Our CFO, Kim Agard, and her staff, they put in an unbelievable amount of extra hours. They were busy to begin with, but they had to deal with the outside accounting firm and provide numbers to them for these analysis. They had to deal with the lenders. Multiple times, as Joel indicated, we had to put this on hold for a year, so now we had to redo all that stuff that we had done prior. So Kim, your staff, again, thank you. One other set of people that me personally would like to thank, again, because they changed my opinion on something, and that is that when we finally determined that we're going to move forward with this, we got to dig into it further. We obviously knew that, but we're going to move into this further. We determined that we needed help in how to go about some of this, which my attitude, if you know me well, I think I can do anything. Well, I know I can't, but I think I can. And I think everybody else should be able to do anything. So we determined that we needed help, and we reached out and looked at a few people, and we hired Orb Management, and they have proven their worth, I don't know how many times, so many times. They've been invaluable. Kim and Wade, thank you very much. To sum it up, again, the board of directors is really excited about this great day. I know there's a lot of work yet to come, but this is a big, big stepping stone. So, thank you.
Thank you, Terry, and thank you for your leadership through this whole time. Next, I want to introduce Representative John Poston, who is a representative for the area to our east. Actually, we're really jumping districts on John, but John's been instrumental in supporting us through this, and especially leading the efforts on the bonding bill to help us with the road reconstruction. So, John, thank you.
Thank you very much, Joel, for having me here today. Thank all of you for being here. And just to echo something that Joel said, thank you, God, for this beautiful day, because like all of you, I've been looking at the extended forecast, and I thought we were going to be standing out here with boots on and under umbrellas in the mud. So thank you, God, for this beautiful day. I've been involved in this project just a little bit, but I have to tell you, I'm so impressed with Tri-County Healthcare. When I met with Joel over a year ago, before the pandemic hit, and they showed me this new hospital and they showed me the new plan, not being a healthcare person, I was so impressed with what they're going to build here. It's so efficient and it's so patient-centered. It is going to be a big step up in healthcare for everybody in this area. It's also going to be a big step up for jobs in the area, and it's going to be a good economic engine in the area, and I think those are really important things. But I have to tell you that the thing I'm most impressed with is the fact that Joel and his team kept this project moving along through some really, really difficult times. I will tell you that conversations we had when this pandemic came along, this project was uncertain. Was it going to happen? Were we going to be able to get it done? Would the funding still be there after the pandemic? And somehow Joel and his awesome team held this all together, took really good care of all of us during the pandemic, and kept this on track, albeit a year later than they had anticipated. So I'm really impressed with that. The way that the COVID care was handled was fantastic, second to none. And the fact that they could keep this project moving forward is just absolutely awesome. I am glad that the state got to play a little part in it. I'm glad that I got to help Joel just a little bit with this project, and proud to be a part of it. Thank you again, Joel. Thank you.
Thank you, John, and thanks for recognizing it. It's certainly more than me. I have an awesome team of really hundreds of individuals behind me. So, next up, we've got Mayor George Dice from the city of Wadena, and of course, we've been working very closely with them throughout the planning of this on infrastructure development, annexation, and a number of other things. So, George.
I told Representative Poston you put your notes on a piece of paper and let them blow away, and then you can just say thank you and walk away from the podium. But anyways, thanks to Joel. Thanks to everybody that's here. What a project. We've come a long ways, hit some bumps in the road that everybody had said, but the importance of a hospital to a community, you can't even put a price on that. The quality of health care at a town our size has been outstanding, and it's going to be even greater with this new facility. And through the pandemic, there was a couple of hashtags that were floating around, and one that always has stuck with everybody, I think, is hashtag Wadena Strong. And we are Wadena Strong as a community, and that's why this project is continuing on. From the city side of it, I want to shout out to someone that's no longer with the city anymore, but our former city administrator, Jeanette Bauer, put a lot of hours into this project working alongside Joel and Kim. And I just want to, she's in Alaska now, so don't feel sorry for her. I want to thank you, Jeanette, for what you have done. I'm sure she'll be watching the stream on this somewhere. But she had come out with Wadena, something is happening here. And it is. Our town is in the middle of just an unbelievable economic growth. The main street is full. We have a library project started. Highway 10 project is done. The groundbreaking here at this important facility. And there's people here should take pride in your community because it is fantastic. The quality of life here is fine. House sales are through the roof. People want to come to Wadena. And so with that, I'm excited. And again, I want to thank the Tri-County staff, Joel especially, Kim, the attorneys that were involved, the time that they spent working through projects and stuff. I want to thank all of them, but especially thank Wadena for being the community that it is. And everybody have a great day. Thank you.
Thank you, George. Next up is Dr. Ben Hess, who is a family medicine physician and chief medical officer at Tri-County. Ben.
Thank you, Joel. So I joined this organization in 2009. I became the chief medical officer about 2016. So by Tri-County standards, I'm the new guy. So with that in mind, you've already heard a little bit about the history of our organization and all the hard work that has gone into this project and all the incredible effort that many people and many hours of work have put into this to get us here today. I want to take a moment now and really start to share the vision of what's waiting for us in the future here. So this site represents transformation. Obviously, the first transformation is going to be the bricks and mortar of the building from the trees and dirt around us. But the next transformation is really going to be in how we can deliver healthcare to this community with this new building. So the concepts of healthcare need to adapt, like all things, and to keep up with the changing technology and the needs of our community. So we have come a long way from doctors traveling around the homesteads in the area on horse and buggy to where we're at today. And just as radical of concepts are coming down the road, probably in my lifetime. It all starts with addressing the social determinants of health. And if you haven't heard of that yet, that involves things like the poverty, poor diet, lack of exercise, lack of good jobs, poor access to education, untreated mental health conditions, and substance abuse. And all these things contribute to the health of our community, good or bad. So a fancy, the social determinants of health will not be solved by fancy new buildings, but they will be solved by the caring people inside that building and the hard work of our communities. And this will in turn transform a community into a healthy environment that people will want to raise their families in, start their businesses in, and make a new life for themselves. When we say this will be a new community hospital, we really mean that. And it will take a community effort to raise that bar of health for everybody. All of us here today played a role in getting here, and all of us will play a role in the health of those around us and the health of our community. We can do this by supporting those in need. We can do this by providing mental health care access, helping with access to healthy food, and supporting new jobs and opportunities for others. That is how our community will become better, and by becoming better, it can transform into something brighter. And when those things might fail, we will be here to help you heal and get back on your feet and support you along your way during your recovery. Thank you.
Thank you, Ben, for those words of inspiration and vision. Next up, we have Steph Larson, who will say some words on behalf of the Tri-County Healthcare staff. Steph.
Thanks, Joel. Feel at a quite disadvantage, being shorter than you guys. Also the long hair in my face, so try to, and managing my speech here. So. Good afternoon. My name is Steph Larson. I am one of the registered nurses here at Tri-County Healthcare, and I've worked here for approximately 18 years. And it's my honor and pleasure to be here representing the 450 staff members that get to call this new facility our home. My coworkers are like a second family to me. I've had the privilege to learn from the many great staff that have worked here and the ones that are currently working here. We are a compassionate group who truly care about the community that we serve. Many employees have been a part of the design process and have had a voice in what the building will look like, how our rooms are going to be set up, and the flow for the patients to make this building the best for our patients and staff. And just as staff have earned this new building to continue to provide our excellent care, it is our patients who deserve that place for healing before everything else. Sometimes, good health is the last thing people worry about, especially over this pandemic, we all know. So without your health, though, you have nothing. We look forward, though, to being able to continue to provide the care and to grow as a facility. This new facility is going to change everyone's perception of what care is and how it is delivered by having all our tremendous providers, specialists, and staff under one roof, making patient care seamless. I'm excited for that ribbon cutting ceremony. Our new hospital and clinic are a symbol for better living. Our mission is to improve the health of the communities we serve, and today is one more step in that journey to continuing our mission for many years to come. Thank you so much for being here, and thank you for letting me be a part of this.
Thank you, Steph. As always, not only your words, but you are an inspiration. Next speaker is Terry Lawaji. Terry is the Community Programs Director at USDA Rural Development. I've actually known Terry since 1999. I mentioned this is our 11th project with them. So he and I have known each other for a long time and gone through a lot of these things together. Terry, thank you for being here.
Thank you, Joel. On behalf of USDA Rural Development and all of our team, I want to congratulate Joel and the entire Tri-County team. I know you guys put a lot of work into designing and planning this project. I want to point out specifically on my staff, Tyler Ray, who was the local contact for us to work with the staff here. I know he did a great job and will continue to do so as he works with you through the construction of the project. And I just want to congratulate the community as a whole for supporting the project and everything you do, and good luck with everything, and congratulations again.
Terry, thank you, and again, thanks for your support. Tyler was a rock star through all of this, absolutely. And interestingly enough, I think Wadena does hold a special place for Terry because he married a Wadena girl. So, and last but certainly not least, Jolene Johannes, who is the chair of the Tri-County Healthcare Foundation. And of course, we've had great generosity already, and she's got some very interesting things to share with us today.
I'm very pleased to be representing the Tri-County Healthcare Foundation Board and the great work that they have done in fundraising for this project. They have really worked hard. And we set a really large goal of raising $3 million to supplement the financing. And we are just delighted with the community support we have received so far. To date, we have received pledges and donations of just over $2 million. Is that amazing? So to reach our goal, we have to raise another $1 million, and we really believe that the communities we serve will help us with that. I personally made my gift because to me, I'm saying a lot of things other people have said, but it's so important to have the best facility and equipment we can have, not only for our employees and providers to provide great health, but just for the general health of our communities. And we want to thank some of our largest gifts and pledges to date so far. The Brown family, led by Kip and Jeff Brown, have donated $250,000 from Wadena State Bank and $100,000 from the Jack and Elvira Brown Family Foundation for a total gift of $350,000. The Tri-County Health Care Foundation is making a gift of $350,000 ourselves, and we just learned that the Otto Bremer Trust is donating $300,000. Part of that is a matching grant. The physicians, thank you. The physicians of Wadena Medical Center have donated $100,000. We need clappers, I think, to make it easier. In addition, there is a $75,000 gift from Dr. Shanine and Kent Schmidt and family. $50,000 has been pledged from Mike and Marion Craig and Ameriprise in Wadena, and they're here. So, $50,000 from Joel and Kim Beiswinger. $50,000 from Dr. John and Ann Pate. $50,000 from Mid-Central National Bank in Wadena. And also $50,000 from the First National Bank of Henning, Ottertail, and Battle Lake. So plus there's a lot of other amazing gifts from our staff, providers, and board members that helped us get over 2/3 of the way to our fundraising goal. But I want to add, while large gifts are wonderful, we are so thankful for each and every gift, no matter what the size. So in the coming months, you will hear about opportunities to join us and have fun activities and help us in fundraising for the project. So thank you so much for coming.
Thank you, Jolene. Again, exciting news. We look at the support for this project. So in closing, I want to take this opportunity again to thank all of you for coming out today, getting to enjoy a really beautiful day with just enough breeze to keep us all comfortable. The inspiration, again, that everybody showed in our Inspire, Build, Transform theme to get us to this point. So thank you all again. Thank you, speakers, for your participation today. We're now going to transition to the shovel ceremony. So what we'll do, shovelers, for the live stream event, we'll grab the shovel, and on my mark, we'll throw it ahead of us. So don't throw it behind or to the side where you get to somebody else. And then Molly and her team, Molly, is that you're going to take over, and we'll arrange several photo opportunities here. So hang around. You might be asked to be part of a photo. So, thank you all again.